once again, my name is Lynn Buskey. I'm the organizer for JONAH and the project lead for this grant program. But we have a number of presenters from our team tonight, and we're going to introduce ourselves first, and then we'll get into our talk. Starting with TJ.
TJ Atkins. I'm the executive director at the community table, and I'm also the vice chair of the Dairyland Housing Coalition for our area.
My name is Kyle Brown. I'm a fellow with the EXPO organization and also a member of JONAH.
Anthony Ledford. I'm a member of EXPO, Just Leadership USA, and the chairman for the Criminal Justice Task Force at the JONAH Network.
My name is Mary Catherine, and I'm a community advocate here in Eau Claire.
Richter. I'm the social worker with Ellie Phillips Memorial Public Library in Eau Claire.
I'm Nikki Walsh. I am the lead organizer for Free, member of EXPO and JONAH.
Okay, so welcome to this presentation from the group LIFT, giving people a chance through housing, reducing barriers. We just introduced those here who are presenting our work, but all the people you see in the screen have contributed to this project, and probably others that aren't listed there. It's been great to connect with so many people on this. But what is this? So Community Catalyst is a policy group out in DC, and they offered to JONAH an opportunity through a grant program to do some work that we wanted to do in collaboration with EXPO and the health department on the rise of homelessness in Eau Claire, particularly for those who have conviction histories and have experienced barriers to getting housing. We wanted to learn from people who have had that experience and collaborate to see what we could do to move the needle in a more positive direction for those folks. So we partnered with Community Catalyst, EXPO, and the health department. The grant itself, it's a $55,000 grant over the course of 18 months. We were one of 3 groups in the country to receive this. We work really closely with Community Catalyst to make sure that we have good tools and resources and guidance along the way. And we built a strong team of so many people collaborating on this, from different groups in the community to individuals, people who've worked with people who've experienced this barrier to housing, people who work with people with conviction histories. And we collected stories from as many people as we could who have these experiences. And when COVID hit, we weren't able to gather in person or connect with the health departments, like the healthcare systems, like we wanted to. So we spent most of the year gathering data about the problem so that we could do some community education. Our main goal is to talk with healthcare systems and to see if we can get them to invest in the work. But as we've been working on the project, we have some larger goals. So starting in summer, we'd like to do some of these other things that are on the screen, and we are looking for funding support to continue this work. Part of what the unique benefit of this project is that we are able to employ people who are trying to turn their not so pleasant experiences into something that can help themselves and others.
Well, good evening. One of the main things that we looked at to give us a foundation in terms of looking at this issue was the social determinants of health. Social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that affects a wide range of health, functioning, and quality of life outcomes and risks. Housing is a social determinant of health. To give you a general idea of some of the Eau Claire County compares to state averages for some of these issues that impact social determinants of health, we have the unemployment rate in Eau Claire County is 3.9 versus 3.2 for the state. ALICE households, or what we known as asset limit income constrained employed or working individuals, we have about 22% of those in Eau Claire County versus 23 for the state average. We also have household poverty of 13% here in Eau Claire County versus the state average of 11%. We are the second highest county behind Milwaukee for county poverty. Please note the numbers from 2018. These are numbers from 2018, so they don't actually represent what has happened now during the pandemic. With all that in mind, now add on to the layer of having additional barriers of a criminal background, history or background. Individuals without homes have greater health issues and often have chronic diseases that can't be managed properly. Here are a few statistics which highlight the dramatic health implications for those who do not have a home. Substance use is often used as a solution for people to cope with their mental and physical health issues.
Formerly incarcerated people are 10 times more likely to become homeless than the general population. National research from the Bureau of Justice Statistics survey suggests that up to 15% of incarcerated people experience homelessness in a year before admission into prison. And city and state level studies of homeless shelters find that many formerly incarcerated people rely on shelters both immediately after their release and over the long term due to lack of housing options for those who have conviction histories. Nationwide studies say that nearly 5 million formerly incarcerated people are 10 times more likely to become homeless than the general population. People who have been to prison just once experience homelessness at a rate nearly 7 times higher than the general public. But people who have been incarcerated more than once have a 13 times higher rate than the general public. Again, we can use the chat feature or anybody that has any comments. Do you have, does anybody see anything that stands out to them or surprises them in this graph here? Is anybody surprised by the numbers here? Can everyone see them clearly?
I was surprised by the number of women who are homeless after experiencing incarceration.
Yeah, that's one of the highest demographics that we've found in there. Along with people recently released from prison, people of color, and people who have been incarcerated more than once. Among many of the barriers faced by formerly incarcerated people, housing is one of the most critical. Having and maintaining stable housing enables individuals to find employment, build relationships, receive mental health care, and avoid recidivism. Of those, EXPO, Free, JONAH, and the University of Wisconsin Eau Claire Honor Program did a screening of 123 inmates from within the Chippewa Valley to capture data relevant to mental health and physical health. This screen took place in October of 2019 and March of 2020. Of those screens, 76% reported housing insecurities, 37 indicated they had no place to go. 35% indicated that they had lived in 3 or more places or had no place to go in the year prior to arrest. A majority indicated they were waiting on a housing list for over 2 years. EXPO and Free have continued to do the interview process with the UW nursing students, and the UW nursing students have found, have been interviewing those who have been incarcerated and released back into the community. And one barrier that continues to come up is housing. Through this collaboration with the nursing students, we found a new way to help break down some of the biases and stigma that the young nurses may have, and with those who have a conviction history or those who are homeless.
This is a very complicated issue, as you have seen so far. Not only are individuals who are formerly incarcerated experiencing more barriers to housing, but that lack of housing is contributing to recidivism that keeps individuals out of our communities where they should be. Furthermore, individuals who are unhoused after release are more likely to have additional barriers such as mental health and substance use that is further getting in the way of being able to successfully navigate the housing system. This multifaceted issue further becomes a struggle when individuals cannot gain employment to support their housing. There are many factors here that are interdependent. So we took a look particularly at Eau Claire and what housing programs we have. We looked at 15 housing programs that are available, and unfortunately found that all of them had some type of a barrier or issue. 100% of these resources have a waiting list of some type. People are not able to immediately get some type of housing assistance if they need it. 80% of these programs have conditions for acceptance that make it difficult for people to qualify. 26% do not take people with conviction histories at all, but 73% that work willingly with most convictions are people, with most convictions, people are still falling through the cracks. And only 6%, and that's one program to be exact, that had any wraparound services for the general population, although 2 have peer support available. 4 programs have case manager check-ins. So what's not working here? Something isn't working. And it's a huge, yes, Nikki's right, it's a huge, huge barrier. So we wanted to find out a little bit more about why the system isn't working in our community.
One of the roles that we all took part in was interviewing impacted people. I know several of us on this project were actually familiar with the 3 people that participated in these video interviews that you're about to see. We interviewed 50 people total, and the vast majority were experiencing homelessness at the time.
Hey, my name is Chris. I'm 32 years old, a recovering addict. I recently had an opportunity to participate in the LIFT questionnaire conducted by JONAH. I've struggled with addiction going on about 11 years. And during that time, I've struggled with homelessness and lack of stability in my life. Some of the barriers that I faced are not knowing what my options were or lack of resources. And if there were resources, a lot of times I wouldn't qualify for them. I've tried reaching out to my probation officer, not telling them that I didn't know like what I could do or where I could go. But he's always told me, or the answer has always been that there was nothing available at this time. It seemed like probation was more of a reactive thing more than a proactive thing. Like if I were to get in trouble or relapse, then I could get like an ATR to go to treatment or something. So it seemed like there wasn't a lot for me unless I messed up. So when I was getting out this last time, when I was incarcerated, I had a lot of stress and anxiety, not knowing like where I was gonna go or like what I could do. So, but luckily, like this last time, there was a program director at the jail I was at that seen that I was concerned about this, and she referred me to treatment. So from there, in treatment, I got referred to a recovery house where I'm at now. But I feel like investing into people and being more proactive and like working with people that are locked up or like in treatment, trying to do better would just be beneficial for everybody. I feel like it could cause like stability and like better like recovery for everybody.
Hi, my name is Amy Nesha. I've been asked to do an interview for the LIFT project, sharing my experience with recovery and the programs that were offered to me. So I guess I'll start off with when I first got out of jail, I was put into a program called Recovery Court, which I think is a great program that like any struggling addict should be put into like right off the bat. It provides like a lot of resources. I went to treatment at Arbor Place. They have a program that's called MRT, Moral Recognition Therapy, TREM, which is kind of like a trauma-based program. I went to day treatment and RPG, which is relapse prevention group. Inside that program, there are so many things offered to help you with your addiction. Outside of drug court, when I was struggling with addiction, I would be in and out of jail, and I wasn't on probation yet. I didn't get put on probation until I went into drug court. And but going in and out of jail, I wasn't offered any type of help, so to speak. One time, I ended up in jail. I was kind of down on myself, and an officer was like, what's wrong? How can I help you? And I kind of just said, I'm a struggling addict. Like, my life isn't at all how I want it to be. And she's like, well, here, I'll have you call this number and see if they can help. And it was basically a suicide prevention line, like a helpline. And it really, I mean, it's not going to do anything. Like, I'm an addict. I need to get my life together. I need to go to treatment. I don't need to talk to someone on the phone. While that was thoughtful, I got out of jail. I came back in, and the officer was like, why are you back here? I thought I helped you. And I said, like, that's not what I needed. That really didn't do anything. Like, you need something that's more intensive than a phone call. I think if there was some type of program in a jail that kind of reevaluates a person that comes in on drug charges, that would be extremely helpful. Like, almost like they would work with the jail, and they would have like a pamphlet or whatever of like resources. Like, if someone's homeless, then they would work with them on that, or if someone's struggling with addiction, then they would see what kind of program they can get them into. But I mean, when you're put in jail, they just want to charge you with something and let you out. That's what happens. But they don't really look at the problem behind, or the problem that's behind the action. Because when you're using, typically bad behavior comes from it. Yeah, that's really what I have to say about it. I think that if people were more informed throughout their addiction, we would see the addiction rate and the recidivism for going back to jail, that rate would go down greatly. Yeah, that's about what I have to say. Thank you.
My name's Heaven. I am 28 years old.
See her.
I am a recovering addict
Weird
of
technical
over 10
things
years.
today.
I am currently homeless. I struggle with addiction, and for resources, they don't have any for me. I was just revoked off probation. I had 2 months left. I had relapsed and gotten sober by the time I was arrested, and due to being clean, I didn't qualify for treatment. So they had to revoke my probation because it was a probation violation. And now that I was released, they don't have options for me. Renters won't rent to me because I'm a felon. I currently have a CHIPS case. I can't get into treatment because I'm clean. And it's just not enough. I do go through the CCS aftercare program. Or no, the CAR program, sorry. I applied for CCS and I do not qualify. I go through the CAR program in Chippewa Falls. I do a relapse prevention class via Zoom once a week. I have reached out to multiple people that just tell me that they can't help because I'm not on probation anymore, and due to being clean. And that's a real struggle. I feel that we definitely need some help with a lot of different factors in addiction, like housing for one, and the proper resources like probation. My probation agent was Nancy Erickson, and she tried to help me, but she could only do so much because of these laws, or because of landlords that refused to rent, or there was always some excuse that there wasn't enough. And she is a phenomenal probation officer and tried so hard, but there wasn't enough for her to be able to do with what she was allowed. And now I bounce and top and try and maintain sobriety even when I'm at my lowest. And I really wish there was better programs. So I hope to God that this gets somewhere, that it'll be beneficial and maybe start changing things for all of us. Thank you.
When speaking with landlords, we found that the lack of help from the agencies was the major barrier. They are willing to work with people with criminal convictions, but they need support systems for the tenant and for themselves.
We wanted to hear the perspective of parole officers working to guide release residents toward resources, and every parole officer that we reached out to, including their supervisors, did not respond to us. But we did get an interview from Officer Mike Majors, and he shared what he sees every day in the job of reactive versus proactive responses, to which he sees the consequences of that every day. Mental health is a concern because no one can get in unless it's too bad. He and fellow officers are unsure of what resources to direct people to because there are so many details and programs. He is frustrated because the clean ones and the ones that want help are often the ones that don't qualify for a lot of the services. His department is reaching out to learn more and to do better working with organizations in the community.
So what we found after doing the survey are some of the patterns from the survey that came up were a majority of those that surveyed did not have a home, and those that indicated they did noted it was with a friend or family. So personal space was very limited. We also noticed a gap in release. If an individual was released from jail, oftentimes it was without resources at various days of the time of day or at night. If they were released from prison, they were typically assigned a case manager prior to their release, which helped them with their discharge planning. More than the majority of the participants had jobs, but can't get housing because of their history of conviction. We're trying and we're still not getting ahead. The main thing they all indicated was that they needed a housing now. A needs assessment was also done on current programs, which Libby talked about, and the gaps were identified, whereas there were a number of programs that lack that wraparound housing type service or peer support. Many of those in the survey indicated that housing was important, but a program that would connect them to the community would be helpful.
My name is Mary Catherine. I have been an advocate for the last 30 years. My passion comes from watching someone with no hope find success. Watching someone who has learned to let go of the past and learn behaviors that has taught them to survive to this point. What is an advocate? It is a person who fights with every breath for the voiceless, the voices that cannot be heard or understood. I meet with them where they are and hopefully provide the tools for them to move up and out. As an advocate, I need to fight the red tape of society, government, agencies, and sometimes the community itself and the biases that come with it. I bring the tools for the person or group so they can move forward and not get stuck in the surroundings they often become very comfortable with living. I fight when the fight is not what the person or community has left. I am their friend, their daughter, and now through time, their grandma. My hope is that there are more people like me than the people that are the ones I help. That as a community, we look at ourselves and ask why in 20 years we have gone from having no shelters to 5. Why is it that we lost 11 homeless last year, 2 of them being vets, and 2 already this year without an outcry? These are men and women. These men and women were someone's child. So yes, my name is Mary Catherine, and I am an advocate here in your community, and I'm out here fighting. Would you like to join me?
So using this lens, we decided with JONAH and EXPO deliberately asked people who were impacted by housing barriers due to conviction history in order to try to expose these gaps and learn more about how resources impact people locally. Part of this too is having conversations. Have you ever had a conversation with someone experiencing homelessness? I want you to truly think about that. How are we to solve this problem if we don't have conversations with the people impacted? So what do you think the cost is when the cost of homelessness and the cost of individuals who are unhoused and who are experiencing recidivism, high rates to the ER? Think about all of this. And there's uncompensated healthcare reports in 2019 are estimated to be 2 million by Marshfield Clinic, 15 million by Mayo Healthcare System, and 5 million by HSHS. So just take that into consideration, and plus many, many more things, the cost of all of this. So as for this, this is just some data that was found related to some reports with hospital visits and how jail overnight stays cost $14,480 per year. for taxpayers. All of these are just costs of homelessness that we're experiencing in our communities.
Besides just spending that we're having on hospital care, it's really a barrier for our community as well. The issue in terms of our shelter costs are increasing and are only a temporary fix versus taking a proactive approach. The United Way Alice report shows a single adult on a household survival budget to live in Eau Claire County in 2018 was a little over $21,000, which although is not great, it is significantly cheaper than to provide an individual without a home. Keep in mind, as Mary mentioned, 20 years ago, Eau Claire didn't have any shelters. Now we are having growing numbers, as evident in our last February, where we had over 100 people in one shelter for just 2 weeks due to cold weather.
So there is some good news. There are programs and pieces of programs that are working. So the first video we've seen tonight was Chris, and he had shared with me his experience with Dunn County and being placed into, well, receiving assistance from their reentry program. And what I am seeing is there's a lot of focus being placed on peer support, applying it to reentry services. Also, the amount of sober living homes in Eau Claire has went up. I know of 2 that were just added recently. We have a tiny home village that was constructed in Chippewa, similar to some of the larger cities in Wisconsin, Milwaukee, Madison. They've had success with them as well. Something that is also being worked on, the Tenant Landlord Resource Center would educate participants on how to be, a responsible tenant, and also that would work with willing landlords in the community to rent to people with past conviction. Another great resource is the In Town, where they can house up to, I think they have like 25 rooms, and they have mentors and certified peer support workers available to assist with the typical barriers that people face with reentry. I think that's another great resource that's fairly new to our community.
Another successful program that we have here in Eau Claire is the Housing First program through Western Dairyland. So the comments on the screen that is in front of you are some impact statements from individuals that have been in the program or have left the program. Just to give you a little bit of background on what this model is, it's a homeless assistance program that prioritizes providing permanent housing to people experiencing homelessness, thus ending their homelessness and serving as a platform which they can pursue personal goals and improve their quality of life. This approach is guided by the belief that people need basic necessities like food and a place to live before attending to anything less critical, such as getting a job, budgeting properly, or attending a substance use issues. Additionally, Housing First is based on the theory that client choice is valuable in housing selection and supportive service participation, and that exercising that choice is likely to make a client more successful in remaining housed and improving their life. Western Dairyland has this program, and last year from July 2019 to June 2020, they had about 46 people in the program. A majority of those were men, and their age ranged from 27 to 60. Currently, the program is funded through HUD, but if we had private or community dollars, we'd be able to expand the program without as much restrictions. Studies have shown the cost savings for this model. One study found an average cost savings on emergency services would be a little over $30,000 per person housed in a Housing First program over a 2-year period. Another found the program could cost up to $23,000 less per consumer per year than a sheltered program.
So peer support is something that is coming up around the country that is showing to reduce hospitalizations and actually just promote overall health and wellness for people. The recovery initiatives in Arizona saw a 56% reduction in hospital readmission rates when peer support programs were administered, allowed. Participants assigned a peer mentor had significantly fewer hospitalization days, going averaging about 10 days versus 19.8, and significantly fewer rehospitalizations, putting it at 0.89 versus 1.53 over a 9-month study. Pierce County, Washington reduced involuntary hospitalizations by 32% by using a certified peer support specialist offering respite services, leading to savings nearly $2 million in just 1 year. Optum Pierce Peer Bridger programs served 125 people. 100% of consumers had been hospitalized prior to having a peer coach in their life, but only 3.4% were hospitalized after they received that coach. And the Georgia Department of Behavioral Health and Development Disabilities found that consumers using certified peer specialist as a part of their treatment versus consumers who receive typical services in a day treatment cost the state about $997 per year on average versus an average cost of $6,491 in day treatment, providing average cost savings of nearly $5,500 per year per person. And then the Wisconsin Peer Link program showed a 71% decrease in number of acute inpatient days per month.
Okay, just a few other examples we found from other parts in the country that are potential options for our community. The FUSE model is a model that identifies frequent users of jails, shelters, and hospitals or other crisis public services, and then works to improve their lives through supportive housing and combining, different groups and departments. Often like the police department will work with the hospitals and such. And Denver had a really interesting model. So they had a program called the Denver Supportive Housing Social Impact Bond Initiative. Add to the evidence that those who experience homelessness want stability, and stability starts with housing. Between January 2016 and December 2017, 363 people were referred to the Denver SIB program, and within 6 months of referral, 311 were located. And of those located, 90% agreed to housing within 6 months. The average time between the initial meeting and a client agreeing to housing was just 6 days, and 81% agreed to begin the housing application process within just a day of being located. Of the 240 people who approved housing applications, almost all participants leased up into housing. In other words, regardless of whether people were actively seeking help, 63% of participants engaged with the program and agreed to move into housing. Very few studies track take-up rates, making this evaluation one of the few benchmarks for engaging participants who are not actively seeking services. We've covered a lot, we've learned a lot, and we want to start working toward next steps to reduce these barriers and get people housed, and helping them move forward in their lives. And it takes all kinds of people. It takes everyone in this room too. So that's why we are here.